New therapy where we can actually get some bone to come back. Again, I can't stress how important the bite is on the health of your gums and periodontal disease. If the tooth is continually rocking in the socket, we can clean the surface of the root all we want. By the next day, the biofilm is going to form again. We need to look at the bite and sterilizing the root to take care of this permanently. So if the tooth is rocking in the socket and we sterilize the root, the bacteria are going to get in there by the next day, form the biofilm, and it's going to start over. The goal is to not have to see us here at Smiles by Design every day. These tiny little gaps that form around a tooth that's hitting unevenly in the bite can lead towards increased rates of bone loss. It can lead towards bacteria getting into the bloodstream more. Restorations that are rough, an old crown that's got a rough margin or a dark margin, or a metal filling that's opened up, or a plastic filling that has an overhang. These all create ledges and areas for bacteria to grow. One of the ways we can look to see if your bite is part of this is with the tech scan. We can have you bite on this computer wafer and it will tell us how hard you're hitting and where you're hitting on each tooth. Ideally, we're in the 50-50 range, 50% on one side, 50% on the other, and you're hitting in the center of each tooth. You don't want to be hitting on the outside edge. Unfortunately, as plastic fillings wear down in the middle of the tooth, we start hitting on the outside edge of the teeth, and that leads towards the tooth rocking in the socket and periodontal disease. These of scaling and root planing don't take care of the bite issue. The bite issue, in most cases, is what led this to happen to begin with. So wouldn't it be a shame to go through all these appointments of cleaning up the gums and then not take care of what caused it in the first place and have it come back a few months later? So I keep talking about the way that we can reverse this. So we've got our regular Prophy, which just cleans the top of the tooth, and we have our scaling and root planing, the one that most dentists do and insurance covers okay. That's the cleaning, the deep cleaning that you've heard of beneath the gums. So that's kind of scraping with the ultrasonic and cleans out most of the chunks. We're talking about laser therapy, laser bone regeneration of the gums. If we shine the laser on the inside of the socket, it removes that infected layer. The laser is super high energy, and any gum tissue that's darker and infected with that bacteria tends to be removed by this. Then we can use the laser and sterilize the root surface of the tooth. Those little bacteria that are living down in there, as soon as we put the laser on there, that kills them too. So now you've got a sterile root surface and you've got clean, healthy gums, and they have a chance to connect again. And we'll actually, in some patients, we see some bone starting to come back. If we take care of the bite on top of that, so the teeth are hitting the right way, we have a chance to beat this disease.
So you're telling me there's a chance? Yeah!
The laser causes biostimulation, which has been shown to increase the body's healing response by up to 6 times. We can get this gum tissue to reattach to the sterile root surface if we use the laser on both. Once we get the infection removed, it's important to follow our recommendations for maintenance, or it will come back with a vengeance. But we won't let that happen, will we? I'm Sean Keller, and thanks for listening.